I'm Ingrid Zegboer. I'm a veterinary surgeon and a RCVS Advanced Practitioner in Veterinary Dermatology. And I opened my own dermatology clinic in Northridge in August. So I'm also a director of Cheshire Veterinary Dermatology. The product in discussion is the NewTom 7G Cone Beam CT scanner. Cheshire Veterinary Dermatology is a referral independent clinic for skin cases only. So we see anything from itchy animals to animals with ear diseases, with pore lesions, or with immune-mediated disease. We love having the Cone Beam CT scanner. We use it in all our ear workups. Most of our dogs have chronic otitis externa, where it's very useful, and we have a few cats as well. I think it's really important that these cases get treated early. So a chronic ear infection is when the dog has problems for on average 4 months. Often I see the dogs after 3 to 5 years, which means that they have been painful for all that time. So I would really advise everybody that has a dog with an ear condition to see somebody a lot quicker. With the Cone Beam CT scanner, we can see detailed pictures of the ear, especially the middle ear. We can also see if there is mineralization in the cartilages surrounding the ear canal, if the skin lining of the ears is thickened, and if there's unusual things like ear tumor, or if there's debris in the ear canal itself. Because we are scanning the whole head, it gives us also information about other structures than the ear. So we can see how the nasal passages look. For example, if there's a tumor in there, or we can have a look how the teeth are doing and feedback that information back to the primary vet for their next dental procedure. With the Cone Beam CT scanner, we can detect a middle ear problem, and then we can plan our treatment, such as doing a myringotomy if we have a middle ear infection. So we can do sampling for culture and sensitivity and flush the middle ear out. If you only rely on your otoscope or your video otoscope, your eardrum might look completely normal, but there could be a middle ear infection going on, which you would not know without the help of the Cone Beam CT scanner. And on the other hand, you might have a completely white, opaque eardrum and think you would have to do a myringotomy, so make a hole in the eardrum, but there might be no problem at all. And if you would do that, there would be the chance of the dog later in life developing a cholesteatoma. Cholesteatomas are a benign epidermoid cyst in the ears. They infect growth of the epithelial cells, and lots of keratin is formed. It's benign, but if the keratin continues to be produced, it will kind of extend the bulla of the middle ear, and it can eventually get so big that the bone of the middle ear will rupture. So in fact, in the last 2 weeks, we detected 2 cholesteatomas in dogs with chronic otitis externa, something that we've never have found out about without the use of the scanner. In cats, the most common underlying problem of chronic ear infections is inflammatory polyps, and we don't know exactly why it happens, but we think it's because of chronic inflammation in the respiratory tract, and either these polyps get formed in the middle ear or in the Eustachian tube, and it can go 2 ways, either into the nasopharynx or penetrate through the eardrum and be present in the ear canal. The very first patient we scanned here, it was a little 6-month-old spaniel that had a cross seed in his ear that was removed by the primary vet, but unfortunately symptoms continued. And when I saw the dog, he was quite happy, maybe a little bit tender, and maybe slight head tilt, but not too bad. However, we did do the CBCT scan and it turned out this dog had a middle ear infection and his ear canal was completely occlused. So we first needed to give him some medical treatment to open his ear canal, and then we could proceed with the procedure to clear his middle ear infection. Computer program is very easy to use. It just took a couple of days of training for us to get used to it. The image quality is brilliant. The resolution of the CBCT scanner is better than that of the conventional CT scanner I worked with, and I can even see the tiniest details in the middle ear. Fujifilm has definitely been proudly by our side, from our initial contact to shipping the machine over the Pennines to installing it into our new clinic, and then excellent training by Collar and Pam, and Alex and Fred ahead even came to our open day just a few weeks ago for emotional support. We've had this scanner since August and we've been really pleased. I'm very proud to have it in the clinic. I'm also very proud to show other people around and show what we've got.